Bovine Ephemeral Fever, 3-day sickness, everything every farmer should know. Have you ever seen a perfectly healthy cow suddenly stop eating, develop a high fever, struggle to stand, and produce much less milk within just a few hours? It can be alarming, especially when the symptoms appear almost overnight. One disease that causes exactly this situation is bovine ephemeral fever, also known as 3-day sickness. In today's video, we'll explain what bovine ephemeral fever is, what causes it, how it spreads, the symptoms you should never ignore, available treatments, prevention methods, and what farmers can do to protect their livestock. Let's begin. Bovine ephemeral fever, or BEF, is a viral disease that affects cattle and water buffalo. It is caused by the bovine ephemeral fever virus, a member of the Rhabdoviridae family. Although the disease spreads rapidly within an area, it is important to understand that it does not spread directly from one cow to another through normal contact. Instead, it is transmitted by blood-feeding insects, mainly mosquitoes and biting midges. This means outbreaks usually occur during warm, humid seasons when insect populations increase. After periods of heavy rainfall, mosquito breeding sites become more common, increasing the risk of disease transmission. Countries across Asia, Australia, the Middle East, and Africa experience outbreaks from time to time, particularly during the rainy season. Now let's look at what happens after a cow is bitten by an infected insect. The virus enters the bloodstream and begins multiplying inside the animal. After an incubation period of roughly 2 to 10 days, the first signs of illness begin to appear. The disease often starts suddenly. A healthy animal may develop a very high fever, sometimes reaching 41 or even 42 degrees Celsius. The animal becomes depressed, loses its appetite, and may stop chewing cud. Soon after, muscle pain develops. The cow may appear stiff while walking, refuse to move, or have difficulty standing. Some animals tremble because of muscle pain. Swelling may develop around the joints, and many animals prefer to lie down rather than walk. One of the biggest concerns for dairy farmers is the dramatic drop in milk production. In many cases, milk yield decreases within a single day. Even after recovery, it may take days or weeks before production returns to normal. Some animals also produce excessive saliva, develop watery eyes, or have a runny nose. Breathing may become faster because of fever and discomfort. Pregnant cows may occasionally abort, although this is less common. Fortunately, despite these severe symptoms, most animals recover within 2 to 5 days. This short duration is why the disease is commonly called 3-day sickness. However, recovery is not guaranteed in every case. Older, overweight, or high-producing dairy cows may experience more severe disease. Animals that remain unable to stand for a long time can develop muscle damage, dehydration, pressure sores, or secondary infections. Without proper care, these complications may become life-threatening. So how do veterinarians diagnose bovine ephemeral fever? The first clue is the sudden appearance of high fever, stiffness, and reduced milk production affecting multiple animals during mosquito season. However, several other diseases can produce similar signs, so laboratory testing is often needed for confirmation. Veterinarians may collect blood samples to detect the virus or measure antibodies produced by the animal's immune system. Modern diagnostic techniques such as PCR can identify viral genetic material with high accuracy. Now let's discuss treatment. There is currently no antiviral medicine that kills the virus directly. Treatment focuses on helping the animal recover while reducing pain and preventing complications. Veterinarians commonly administer nonsteroidal anti-inflammatory drugs, also known as NSAIDs, to reduce fever, relieve muscle pain, and improve comfort. If the animal is dehydrated, intravenous or oral fluids may be required. Electrolytes can also help restore normal body function. Animals that cannot stand should be moved onto soft, dry bedding. Farmers should help these animals change position regularly to reduce pressure injuries. Fresh water should always be available, and nutritious feed should be offered once the animal begins eating again. If secondary bacterial infections develop, the veterinarian may prescribe antibiotics. It is important to remember that antibiotics do not treat the virus itself. They are only useful against bacterial complications. Most cattle begin showing improvement within 24 to 48 hours after receiving supportive care, and many recover completely within several days. Can bovine ephemeral fever be prevented? Prevention mainly focuses on controlling insect vectors and strengthening herd immunity. Reducing mosquito breeding sites is extremely important. Remove standing water wherever possible, clean drainage systems, and improve farm sanitation. Insecticides, mosquito traps, and approved repellents can also help reduce insect numbers. Housing animals indoors during peak mosquito activity, especially at dusk and dawn, may further decrease exposure. In countries where vaccines are available, vaccination remains one of the most effective preventive measures. Farmers should follow the vaccination schedule recommended by their local veterinary authorities because vaccine availability and recommendations differ between regions. Farmers should also monitor their animals closely during high-risk seasons. Detecting illness early allows treatment to begin before severe complications develop.
Let's clear up a few common myths.
Myth number 1: bovine ephemeral fever spreads directly between cattle. False. The virus is primarily transmitted through infected biting insects rather than direct animal-to-animal contact. Myth number 2: every infected animal dies. False. The majority of animals recover completely with proper supportive care. Myth number 3: antibiotics cure the disease. Again, false. Since this is a viral infection, antibiotics only help if secondary bacterial infections occur. So why is this disease economically important? Although death rates are usually low, outbreaks can cause major financial losses. Dairy farmers may experience reduced milk production, beef producers may see weight loss and slower growth, breeding programs can be disrupted, and veterinary treatment costs increase. In large outbreaks, these losses can affect entire farming communities. The good news is that with early recognition, prompt veterinary care, mosquito control, and vaccination where available, most animals recover successfully and farms can greatly reduce the impact of future outbreaks. To summarize, bovine ephemeral fever is a mosquito-borne viral disease of cattle and water buffalo. It causes sudden fever, stiffness, muscle pain, reduced appetite, and a sharp decline in milk production. Most animals recover within a few days with supportive treatment, but prevention through insect control, good farm management, and vaccination remains the best strategy. If you found this video helpful, don't forget to like, share, and subscribe for more evidence-based videos on animal health, livestock management, and veterinary medicine. Thank you for watching, and we'll see you in the next video.